How's it, aloha gang, and welcome back to High Now Daily. Right now we're talking about Rehab Hospital of the Pacific, some of the highest care that you can get here in the state of Hawaii. Here to tell us more is Stephanie Nadolny, President and CEO, Rehab Hospital of the Pacific. Welcome in.
Thank you. Thank you so much for having me.
Thank you very much for being here. Now, a vital resource you folks provide in terms of really helping families navigate what is oftentimes one of the most difficult medical decisions people have to make.
Yes. So when something terrible happens, like someone has a stroke or a traumatic spinal cord injury or brain injury, that decision of what to do next, like how do we get our life back, is one of the first things that they have to deal with. And we're really fortunate here in Hawaii that there is only one rehab hospital, and that's what we do, is help people rebuild their lives. But it can be kind of a confusing decision too, because rehab is offered in a lot of different settings. And what we like to share is that, you know, for the worst cases, for the most serious injuries, you want to be in a hospital. A hospital that has doctors there every day, physicians who are available 24/7, nurses who are specially trained rehab nurses, and a team of therapists and other professionals who have a really high level of expertise that you're not going to find at other places that offer some levels of rehab.
Now, expand a little bit more on a very specific distinction that comes along with being a part of Rehab Hospital of the Pacific and the care that you guys provide.
Yeah, I think what's distinct is that it's a real intense level of rehabilitation. When patients come to us, they have typically about 3 hours of therapy a day. I mean, imagine working out for 3 hours a day. That'd be exhausting. Right. So it's really intense, it's very focused, and it's by, again, people with a real high level of expertise who have special training and working with people who've had a spinal cord injury or a stroke or a brain injury. It's very unique and very skilled at what we do.
Absolutely. That leads into, as we look at some images of some of the procedures that take place there, this is all part of that rehab process. But also, you mentioned as well a dedicated team of professionals, and even with them, with their qualifications and distinctions, right? They're getting highest possible care in terms of these very intense training sessions, right?
Yeah, and a high level of equipment, too. We have really all the technology that is current in the rehab world. All the tools that people need to help them get better, whether it's, you know, fancy electrical stimulation bikes or, you know, just all the gadgets that really will help someone reach their goals faster. And that's super important. We try to make sure our technology is up to date, but with things that provide a lot of value, that, you know, it's not just the shiny object, but the thing that would really help a stroke patient recover more quickly, get home, and be more independent.
Because in the rehab process as well, we're not necessarily looking for the person to get back oftentimes to where they were. Obviously, that's one of the goals, but even to have these people go back and thrive, get their independence back because they've gone through something traumatic oftentimes.
Right, and the road back is not quick. I mean, they may only be with us for a few weeks or a month, but once they get home, that recovery continues. So we offer, of course, outpatient services as well to continue that journey, as well as a lot of community activities and support so that they feel hopeful about what the future holds, whether it's adaptive swimming or we do adaptive cycling. We just had our first adaptive climbing class. Things that show that despite maybe my body not cooperating like it used to, I can still live a full, vibrant life.
Now, in addition to the services that's provided there, as you mentioned before, Stephanie, tough thing to navigate for a lot of families, given there's so much information, very vital decision. What do you want people and viewers know, families to know, that when people come to the Rehab Hospital of the Pacific, what should they expect?
Yeah, they should expect to be tired, that, you know, we'll ease them into their treatment, that they begin to hopefully see progress within a few days, that there'll be a treatment plan set up with them and their physician and their nurse and their therapist to really set the map forward for how they will get on the path to wellness. It really varies how long people stay. It is a short-term rehab. It's not meant for months and months, but that's why it's so intense, and to set that foundation for a full life following.
Stephanie, how do people get more information about Rehab Hospital of the Pacific?
Yep, www.rehabhospital.org, and that's where you'll find our community events as well, and all the services we provide, and important phone numbers if you need to reach out.
Stephanie, thank you so much for the time. We just had that listed up there on your screen as well. For more information about Rehab Hospital of the Pacific, head to HighNowDaily.com. We'll be right back.